Hello, everyone. I'm William Schaffner. On behalf of CME Outfitters, I'd like to welcome and thank you for joining us for episode 2 of a 3-part CME OCast series on best practices for implementing a shingles protocol in your practice setting. Today's episode is titled Implementing a Shingles Protocol in Pharmacy Settings. This activity is brought to you by CME Outfitters, an accredited provider of continuing education for clinicians worldwide. As I mentioned, I'm Bill Schaffner, professor of preventive medicine and infectious diseases at the Vanderbilt University School of Medicine in Nashville, Tennessee. And I'm very pleased to be joined today by my friend and colleague, Michael Hogue, who's dean and professor at Loma Linda University School of Pharmacy in Loma Linda, California. Hi, Michael, welcome.
Hi, Bill, thanks.
So to frame today's episode, let's start by reviewing our learning objective, which is to develop best practices to implement a shingles protocol in the setting of the pharmacy. So Michael, let's begin our discussion today with a little background about the incidence of shingles, who's at risk, and the most notable complications with this disease.
Well, Bill, thanks so much again for having me. And I just wanted to let your listeners know that pharmacists are really important or critical, frankly, to ensuring that we improve immunization rates against shingles. Shingles is a significant disease that should not be underappreciated because over 1 million people each year develop the shingles. In fact, and this is something that very few people understand fully or really have thought about, but 1 in 3 adults will develop shingles in their lifetime. And as lifespans get longer, that number could go up. So we know that that's important. Not only that, as we age, our risk goes up. And in fact, half of all of the cases of shingles that we see occur in people over age 50, which speaks to a lot of our strategy that we'll talk about a little bit later in terms of immunizing. And then, of course, the other thing that pharmacists need to realize, and pharmacists have been very stymied by the treatment of shingles and its complications, because post-herpetic neuralgia, PHN, is one of the most significant and painful conditions that our patients can have. And we know that the treatments for post-herpetic neuralgia are not great. So it is wonderful that we've got a vaccine that we can actually prevent the development of shingles and prevent post-herpetic neuralgia. Of course, there are more serious things that can happen with patients too, such as ophthalmic involvement with shingles and more disseminated infection that could lead to meningitis or encephalitis and very serious conditions in and of themselves. But shingles is nothing to mess around with and no simple condition as many people might think it is.
You know, I think you're absolutely right. There are many people who don't really understand shingles, who's really at risk, and the potential, particularly the long-term burden of post-herpetic neuralgia. So, Michael, what are some of the misconceptions that you've encountered, and what role can actually you and your colleagues as pharmacists play in educating individuals about shingles?
Well, you know, pharmacists have people come into the community pharmacy setting, particularly all the time, and say, can you take a look at this rash? This rash is here, and what kind of a rash do you think I have? And so, you know, one thing that pharmacists can do is just be alerted to the fact that the presence of a rash, and it could be lots of things, but when you have a painful rash that's located on a single dermatome, that ought to be a red flag. That ought to cause the pharmacist to think, okay, this might be shingles. And in addition to that, patients often think, well, all I've got is a rash. It might hurt a little or it might hurt a lot, but it's just a rash and it's going to go away. Well, it's not that simple, of course, as we know. That's an opportunity for a pharmacist to intervene. That patient probably requires a referral to a primary care provider to be evaluated and to determine, in fact, or confirm that it is shingles and get appropriate treatment. So that's one, Bill. Second thing is that, you know, 70 is the new 40. Everybody believes now with all the youthful things that we do, the exercise, we have all of these sports fitness facilities, and here in Southern California, you can be outside walking and jogging and running all the time, playing tennis any day you want to. So people say, well, I'm physically fit. I'm not at risk of any illness. I eat well. I have a healthy diet. I exercise. I do all of these things. But the reality is that even if we do all of those things correctly, the aging immune system still progresses. Our immune system still age. And so we're still at risk for developing shingles. And I think that's an important one as well.
So that's all important information. Now we're going to transition a little bit, Michael, because as we both know, let's face it, adult vaccinations are often underutilized. Maybe it's a matter of one group of providers thinking that the other provider is going to do it, but here's a real opportunity for pharmacists, right? So why don't you talk a little bit about that?
Well, I do want to share with you a little bit of information here from the American Journal of Preventive Medicine, and I think it's important to note that pharmacists have, from the first shingles vaccine that came to market, have been very involved in shingles immunization programs, primarily because Medicare Part D, as in David, has been the primary coverage mechanism for most people who have Medicare benefits. To be able to be provided the vaccine. Now, of course, what's happened is that the age indication for shingles vaccine has expanded, and we're now giving the vaccine down to age 50, so people over age 50. And that has meant that we've needed to build other kinds of insurance. And so pharmacists have had to think carefully about how to do that and how to help patients have access. Now, what we know is that in a recent survey of both pharmacists and clinicians and looking at strategies for implementation and referral in the event that they don't provide shingles vaccine within the pharmacy or other healthcare practice, we do know that a vast majority of pharmacists do say that they assess their patients for their need for shingles vaccine. So that's a good thing. And I just would like to say it's very important that pharmacists are intentional about assessing their patients for the need for vaccination. And there's a lot of computer aids that can help us with that, and that's important too. The second thing, though, we know is that slightly fewer, and it's definitely not 100%, so nearly 80%, of pharmacists are actually recommending zoster vaccine to their patients. Proactive recommendation, which we'll talk about just a little bit later, Bill, I think is probably an area we could do better with, that we could do much better in proactively recommending. But the one thing that's incredibly surprising is that if you compare primary care clinicians to pharmacists, most primary care clinicians' offices don't stock zoster vaccine. So because they don't stock it, and pharmacies, by and large measure, 90% do stock the vaccine, this really emphasizes why it's critical that pharmacists be engaged heavily in giving shingles vaccine, because physicians are referring patients to pharmacies to get these vaccines. And it would be a travesty if that referral happened and the pharmacist was unable or did not pull through with that prevention recommendation that came from the primary care provider.
That's the way we do it in my institution. The internists generally refer the patients to the pharmacist, for at least those patients age 65 and older, to the pharmacist for the immunization. Now, we've talked about vaccines, so let's talk about vaccines. There are a couple of vaccines that are FDA approved. Say a few words about these two vaccines.
Well, I think pharmacists are aware that originally we had a live attenuated vaccine for zoster that was approved for use in people 50 and older, but recommended at the time for use in patients age 60 and older. This live attenuated vaccine is no longer being marketed in the United States. And so, but it is possible that there are pharmacies that may still have that vaccine on their shelves. It's unlikely, but it's possible. And what we would say there is that vaccine, as a live attenuated vaccine, had certain contraindications to its use and precautions. We had to watch out for patients who were immunocompromised, for example, and we had to be very careful with storage and handling of that live attenuated vaccine. It was really an important thing. So, there are no serious side effects associated with the vaccine, but the effectiveness of the vaccine was just not optimal. Believe it or not, for a live attenuated vaccine, we expect normally to have these very nice antibody titers and get this great immune response that lasts a long time. That's typical of a live vaccine. Unfortunately, we really didn't see that. It didn't really pan out that way as we gained experience and with time. So in comes a newer technology vaccine, a recombinant adjuvanted vaccine. That vaccine is actually recommended for people of 50 and older, largely because we have efficacy data that shows that our antibody titers are much higher with that vaccine and that our immunity seems to persist for a much longer period of time because of this adjuvant. So this is not a live vaccine. It's an inactivated vaccine, just to be very clear. It uses an adjuvant to help enhance the immune system response. And so we can use this vaccine at a bit younger age, at 50, which is, as I said earlier, the age where we start to see real increases in the number of shingles occurrences. And lastly, storage and handling is a little simpler here because we can store this one at a normal refrigerated temperature and reconstitute it and get it in the arms of our patients pretty quickly.
Yeah, so great. We've got a gangbusters vaccine, but what can pharmacists do in that setting to increase the acceptance of the vaccine by the patients whom they serve?
Well, here's the deal. The new vaccine that we use, while it has this incredible effectiveness, it causes a pretty sore arm. Lots of patients complain about a sore arm. And guess what? People talk to each other. Oh, I got this vaccine and it caused my arm to hurt. Well, yes. So one thing pharmacists can do is to be upfront and honest with patients. This may cause a sore arm, but guess what? That's going to go away in 2 or 3 days. And once that goes away, just imagine the pain you could have had from shingles that you're now preventing. And the pain on a short-term basis in your arm from a vaccine is nothing compared to the pain of shingles. And I think that's an important message. The second thing is that we need to be proactive. And I mentioned this earlier. Pharmacies are very busy places. I totally get it. I completely understand, as a former community pharmacy owner myself and having worked in big chain box stores in the past myself, I understand how busy pharmacies are. But prevention is critical, and patients may not understand their risk and they may not know clearly of their need for vaccines. So we need to move to a model where pharmacists are reaching out to patients, proactively recommending vaccine, and not just simply waiting for someone to come in and ask for it or waiting on a physician to prescribe it. We need to be moving forward with very proactive immunization practices.
I like all that. And I'm going to give you another opportunity. Any other strategies that you might suggest that are helpful in the real world?
Yeah, well, another thing that I think is very important is that there are so many myths out there about vaccines, and people have misconceptions. They think vaccines are for kids. They don't realize they're for adults. Adult immunization campaigns require a different strategy. Having specific messaging for adult patients is really important. But one other thing I want to say also, this is a team sport. Vaccination is definitely a team activity. You in the pharmacy, you have an important role to play in advocating with your patient to be vaccinated. But if they refuse to be vaccinated on a very practical level, don't take no for now as to mean no forever. Refer the patient back to their primary care provider. if you can't convince them to be immunized today, encourage them to have a discussion with their physician about the vaccine the next time they're with their physician. Think about notifying, using your electronic medical record capabilities to communicate with physicians and communicate with the physician that the patient wasn't vaccinated and needs to be vaccinated. And then remind yourself the next time the patient comes in to ask again, to not necessarily give up. Things go on in patients' lives, and today may have just not been the best day for them to be immunized for their own personal reasons, but tomorrow is always going to come around the corner and you can ask again.
I think that that's wonderful because pharmacists have the most interaction of all the healthcare providers with patients. So you'll get another crack at that patient
That's right.
pretty soon, probably, right?
That's right. That's right.
So pharmacists play such a critical role in increasing vaccination rates for shingles. I'm all for it. Take us through both some preferred as well as less ideal ways of communicating with individuals about shingles vaccination.
Well, Bill, there is actually a study that's been done to look at this very issue about what pharmacists are actually doing that's effective in their practices and what they're not doing now. And so there are probably reasons behind all of those things. This study was published in the journal Vaccine by colleagues at Auburn University. So it's a very well constructed study. It was a survey of community-based pharmacists in a couple of states. And, one thing pharmacies can do is use their wall space. That's really important. This study found that having posters and messages around the pharmacy was found to be pretty effective. And I have to concur with that because not all the time is it possible for the pharmacist to have a personal conversation with every patient that enters the pharmacy. But having well-designed advocacy posters in the pharmacy, that could be great. That could be a good way to do it. Using the already existing systems in a pharmacy to remind patients to be immunized or to message patients is another thing that's very important. That might be using flyers that maybe a clerk or a pharmacy technician inserts in the bag when the patient picks up the prescription to advocate with the patient. That could be using your telephone on hold waiting messages to give messages that advocate for the patient to be immunized. Social media. Many community pharmacies use ad circulars that are still left at patients' mailboxes. Include vaccine messages in those ad circulars when they're left in. That's an important thing to do as well. And another thing that pharmacists have found very effective: let your local physicians know that you are an immunizing pharmacist and that you have vaccine available in your practice, because if physicians are aware that there is vaccine available nearby, they're going to be more likely to refer those patients to you so that you can administer those doses of vaccine. So those are very, very good things to do. And then I guess, Bill, the last thing I would just say is this doesn't have to be expensive. And I think a lot of pharmacies think when they do promotional things that they're going to spend a lot of money. I really don't think that's necessary. We know that good word of mouth discussion with patients and advocacy is probably the most effective way to convince someone to be immunized.
Michael, I love your emphasizing the immunization neighborhood, letting the docs know we're all in this together, trying to get our patients vaccinated. I'm going to give you one last chance here. Thanks for providing a great discussion. But as we close, do you have some key messages that you hope the viewers will take away with them to encourage them to do more about promoting shingles in their pharmacy practices?
Well, one thing that I would just like to suggest is that when you have time in the pharmacy available, maybe with staff coverage overlap, You have extra technician hours, which I know are hard to come by. Use those times to proactively call patients and talk with them on the telephone about their need for immunization. It's very important to do that. And telephone calls are incredibly effective, especially when patients need multiple dose vaccines, like shingles vaccine, which requires a couple of doses. Using the telephone to remind patients and using text message reminder systems, also very, very effective at getting patients to come in and get their second doses and to also be sure that they are fully immunized. There's just so many things that you can do, again, proactively with your patients individually. The one thing I will caution everybody about, and I think this is always important to realize and recognize, there is a bit of a concern about mass mailing of patients that may be in your database with a message suggesting that because they have a certain condition, they need to be immunized because there are some HIPAA laws. And so I would just say that if before you do any kind of mass mailings, check with your attorney to make sure that what you're doing is not going to violate HIPAA. But generally speaking, there's nothing better than the personal relationship between a pharmacist and his or her patient to be able to really have a serious conversation about the importance of vaccination and the importance of health. Trust between a healthcare professional and their patient is something that is so valuable in today's world. And this is a society where trust is not always there with everybody, but guess what? Nurses, pharmacists, and physicians still maintain high levels of trust. We have a great responsibility in our society to advocate for the truth about vaccines and to advocate that our patients receive them.
Michael, what a wonderful way to end. This has been a great session. Thank you so much for participating. Now, to all the viewers, to receive CME or CE credit, click on the link identified here to complete the post-test and the evaluation online. Thank you all for joining us today for episode 2 of our 3-part CMEOCast series. To view additional episodes on best practices for implementing a shingles protocol in primary care or specialty care settings, please visit CMEOutfitters.com. Thanks again for participating, and thank you for providing the best care for your patients. Please, everyone, stay safe and vaccinate.